Anterior approach hip replacement surgery usually takes 2 to 4 hours, depending on the condition of the patient. The surgeon will start at your upper thigh and expose the hip joint. The surgeon then removes the diseased portion of the femur or thigh bone and prepares the hip socket by reshaping the bone to accept the cup portion of the hip replacement implant. A temporary implant is used to test, size, and position the hip cup, which is placed in the hip socket. Once the temporary cup is tested for the optimal fit, the process of implanting the hip stem begins. A handle is attached to instruments called broaches, which are inserted to widen the canal inside the thigh bone. These broaches will act as a temporary implant until the surgeon determines the proper size of the permanent implant. During insertion, the surgeon utilizes an X-ray to position the implant accurately. The surgeon then selects a final hip stem replacement of a specific size that is best suited to the patient and inserts it into the thigh bone. The hip stem implant is slightly larger in diameter than the prepared cavity and is inserted with a press fit that produces initial stability. The surgeon does a final check of the positioning and movement of the combined hip stem and hip cup implants. Finally, all surfaces are cleaned and the hip is closed. The average hospital stay for hip replacement with the anterior approach is 1 to 3 days, as opposed to the standard 3 to 5 days for a traditional hip replacement. During this time, a therapist will assist you with walking. Physical therapy continues after the hospital stay. It's important after your surgery to keep an eye on the incision. If there is increased redness, tenderness, swelling, if there's drainage, or if you have a fever over 101 degrees, it's time to call your doctor. Any infection must be promptly treated. Some discomfort after surgery is normal, and pain is managed with appropriate medication.